Thank you very much, Professor Tang, and thank you very much, Pradeep. I started this project as part of my PhD program. I joined in UNSW as a PhD student back in 2009. So like all other PhD students, I was equally excited to start a research project in mHealth. And my project was basically a quality database of mHealth in developing countries. Right now, I'm serving as a senior lecturer in the University of Wollongong in the School of Management, Operations, and Marketing. So the research motivation came from the mobile revolution. At present, we have more than 7 billion people in the world. And guess what? The number of mobile subscriptions. It has exceeded 7 billion. So this is one of the technological platforms which has penetrated so fast and so deep into the global community. And that was our motivation to start working on this mobile platform and to start conducting research on mHealth. Let's watch a video, a very short video, to give you some ideas of what mobile health, how does it work.
The provision of healthcare through the use of mobile devices or mHealth is becoming a global reality. The lower costs, immediacy, and widespread availability of mobile technology are changing the way patients receive their care, making healthcare faster, better, and cheaper. According to PwC commissioned research by the Economist Intelligence Unit, the general perception in the marketplace is that mHealth will have a significant impact on the delivery of healthcare and bring about fundamental changes to the way the industry provides healthcare and does business. mHealth is already having an impact throughout the world and at different rates of adoption, with emerging markets moving faster than developed markets. And yet, significant barriers to adoption must be overcome. Perceptions between doctors and their patients vary. Both doctors and patients see the promise of mHealth, but while patients believe it will improve access and lower costs, some doctors perceive mHealth as a disruption of their traditional roles. Meanwhile, payers will evaluate mHealth based on its potential value to the industry and to their customers. They align themselves more closely to patient interests based on mHealth's ability to help with wellness and prevention. Despite varying perspectives among key stakeholders, change is coming. Businesses will need to develop patient-centric business models that focus on optimized clinical outcomes, value for money, and patient satisfaction. They will need to create solutions which are fully integrated and operable as part of a new healthcare ecosystem. In this changing industry climate, the differentiation between a healthcare strategy and a mobile healthcare strategy will be dissolved. Mobile healthcare strategy is critical because mobile is beginning to define the future of healthcare.
That was briefly how does this mobile healthcare work, and from business point of view, we need to take a look both patients' perspectives and providers' perspective. And my research basically focused on patients' perspective. We evaluated the quality of services from patients' perspective. And in order to progress on this research, we focused on developing countries. And why we focused on developing countries? Because if you take a look at these primary healthcare indicators, you will probably notice the staggering figures of healthcare in developing countries. If I just take a look at infant mortality rate in 2 developed countries and 2 developing countries, you can see the difference. And that was basically the reason why we jumped into developing countries with the promise of mobile health. And we also found that mHealth can transform healthcare very quickly in a rural part of the world. And also we have got that numbers, 60% penetration of mobile phone in developing countries. As part of my research, I focused on health hotline services in Bangladesh. Health hotline services was first introduced by Grameen Phone in Bangladesh. Grameen Phone had, at that time, more than 25 million customers. Right now, more than 50 million customers have access to mobile phone-based health hotline services. Any patient or any customer can access to this service by dialing 789. They can pay 21 cents for 3 minutes, whereas the nearest GP charges $3. And patients can access to medical information, consultation, treatment, trials, diagnosis, referral, counseling. Registered GPs, they provide this service under the platform of the mobile operators. As part of our investigation into this platform, we came across some challenges. And all those challenges came from service delivery point of view, interpersonal communication challenges between doctors and patients, overall outcome challenges, satisfaction, value, continuance, quality of life. These are the very critical indicators of sustainability of business model. And we brought those concepts into picture in order to assess our sustainability. 2 research questions we framed at the beginning of our research. The first research question was, what are the dimensions of service quality of mHealth? And the second question is there any impact of quality on value, satisfaction, continuance, and quality of life in this context? The research was funded by WHO Global mHealth Assessment Program. And as I said, the team, that means it was part of my PhD, and I was supervised by Professor Pradip Rai and Associate Professor John D. Embra. The theories we used from health services and information systems point of view, as I said, and as Pradip said, mHealth research must be and should be guided by multidisciplinary point of view, because you have got technology, you have got perceptions of consumers or patients, you have got all other sustainability parameters. So it must be guided by multidisciplinary point of view, and that's what we did in our research. And as part of methodology, we collected, it was a positivist quantitative research, so we collected data using area-wise cluster sampling. We collected data under cross-sectional survey. After collecting data, we found that this was our first research question: what are the dimensions of service quality? And we found that service quality has got 3 primary dimensions from patient's point of view: platform quality, interaction quality, and outcome quality. And all our mathematical modeling figured out which dimension is more important, which one is less important. The research was reported in 2 top outlets in business journals. As part of our second research question, what is the impact of service quality on service outcomes? And again, we modeled that overall service quality has significant impact on all these service outcomes, which basically determine the sustainability of mHealth platform. Again, we reported findings in 2 journals. Our selected research on mHealth was reported in different outlets, like EMEA Yearbook of Medical Informatics. We also investigated trustworthiness. We investigated continuance of mHealth at the bottom of the pyramid. We investigated how to develop a systematic review of mHealth. And finally, we distinguished mHealth from other healthcare services from quality point of view. As part of future research, we are proposing to investigate service quality from both patients and providers' perspectives. Differences in service quality perceptions between urban and rural customers, developed and developing countries. Evaluation of service quality using longitudinal study, because one of the limitations of our study was it was a cross-sectional study. And as you can guess, cross-sectional study has got some limitations because it focused on a specific point of time. Analysis of big data, which I'm investigating now as part of my investigation of big data research. Now I'm proposing to investigate big data in mHealth to identify patients' demographic segments and predict service users. That's it from my part. Thank you very much.